Hi, I'm Dr. Baum, and I will be showing you exactly what we do at this aesthetics office, how we're different, how we're similar, and how we make the competition wish they could jump off a cliff. Now, we are going to have my first patient come in. Let me just give her a quick call. Fawn.
Hello, love.
We need you in the office.
I'm on my way.
Alrighty. Round of applause for Fawn. Stop. Thank you. Take a seat, Fawn. Oh, wow.
The story about me and Dr. Baum is that I walked in, I looked at her, and I said, I want to look just like you. And you were making it happen one surgery at a time.
We're just excited to be here. And
Oh, some of my goals is coming off.
I might screw up, and I might refer to you as double breast augmentation, double liposectomy. And so just so you know.
And don't forget the elbow.
Well, yes.
I just got my elbow done just the other day. I'm so excited to try it out at work. You have absolutely changed my life with all the surgeries you've given me. I'm so excited to be here today. I actually haven't seen your new office.
Yeah, we decided to do cheetah, which I really love. This is, well, my husband, he goes on his safaris and he does his hunts, so this is real. This is real cheetah.
So I'm an actress that's from Australia, and I've been trying to come to you for different body work for quite some time, and finally we have mastered the look, and I'm so excited to recover from some of the surgeries I had on Wednesday.
Yeah, we're excited to talk about what we can do in the future once you heal up. Yeah.
I feel like there's so many other things you want to do that you're pushing me about, and I've still been like, I don't know if I want to do that or not, but we'll try to see what we can do.
Well, we're going to do the shoulders, and I was thinking the knee. The knee could come in. I think the knee could come in 40 more. So I did want to chat about what you mentioned earlier. I want to look exactly like Dr. Baum. Now, that's going to be a pretty difficult feat because I am completely all natural. I've never had a single surgery.
Even your breasts are real.
Yes.
When I saw a look at these breasts, and I thought, these are two breasts. I've never seen something this big before and juicy. And you said they're real, and I said, oh my God, no wonder you got into surgery trying to make everybody looking like you.
You're silly. But I did want to talk about, your experience at the office, what the bedside manner is like, and if you've run into people treating you differently after you started looking better.
I think that for me in my job, I am constantly meeting new people and interacting with them. Has people taught me to be treated different because I'm looking better? Yeah. I did a movie recently with Jacob Elordi. He was trying to have sex with me in the bathroom in the middle of the day. That's never happened to me before. And suddenly, this tall guy from Euphoria is trying to hit on me. I go, okay. I am single. I might as well have a little fun at work. That's never happened before. When I had a completely too big a breast. She took them down. We realized that was too small. She took them back up again. I'm getting casted different in different roles. Before I was kind of the fat friend, and now I'm the leading lady.
Wow. And this isn't an infomercial. It's more of a, I just would like to teach people about my practice a little bit more.
Yeah.
The different things that we do things a little bit differently here. And
Also, as soon as I got my legs replaced, I got a Gucci Valentina purse.
Round of applause.
Free things. I've gotten free Crocs. I've gotten free bags. So much stuff in my house, I can't even belly walk in anymore. Oh,
let me help you with that. This is her fourth or fifth nose.
This is actually my 7th rhinoplasty this month. This woman has not gotten me out of the medical chair and let me get out of her hospital.
I was originally trained as a dentist, so this isn't something that I was doing in college.
But you do have your license.
Sorry, 1 second. I need you to be quiet while I'm checking your heart. I think you're gonna be, can we get her some coffee? Something to just get that thing beaten. This is something that a lot of, thank you, sweetie. This is something that, and could you take it back?
Sorry, arm is so weak from the surgery. Thank you, love.
Well, it'll get stronger. It's just healing.
I also decided to go blonde. Once I started getting the surgery, I was a mousy brown, and I decided that as soon as I had the body to match it, I was about to go blonde.
Seeing a bald spot back here.
Stick to your own black bob. I don't want you touching my blonde hair, because as soon as this person starts picking around, she's gonna all of a sudden start getting the big scissors, the big knife, the scalpel, cutting things off that you didn't even know you had.
You're silly.
I was in The Marvelous Mrs. Maisel, one of the audience members in season 1, and that's the kind of catch role I would get. And now I'm totally the leading lady. I'm doing a rom-com next year.
I'm glad you mentioned it's next year, because it will take a few more weeks for this to go down. Sorry.
You want to do the reveal, the news?
This to go down. Let's do it. Sorry.
That's what you call a movie star nose. I do think that some of the directors I've been working with have started to be a little bit nervous about the amount of Botox, about the size of my lips, especially if I was going to be in a period piece. Because
there's a big wrinkle. Sorry. You have whenever you're talking, there's a big wrinkle. Let's try it. We're going to cover that up.
But I want to know more about your practice, because I've known to share so much about myself in your office, and I have not even begun to uncover how you got into this business. I've never known about your other patients, and I wanted to ask you, what are you looking for in a patient, and also who else of the actors are you working with these days?
Believe it or not, this practice isn't necessarily my passion. We all do things in life where we're just doing it for the paycheck. And it's great to have someone like you who has pretty much endless resources to income. You're married to a very old man. And
I said I was single. The marriage is over between me and Donfried. He is scum of the earth. And I'm single now. So I have gotten alimony, but there's only so much to go around. He's not as rich as you think.
So, sorry.
Yeah. Donfried is done.
When we say it's done, he's not giving you any. Sorry, not giving you any money.
He's giving me a small check of alimony, but most of what I've gotten is from brand deals and a couple of movies I've done with Johnny Bravo, with the guy from Euphoria that I mentioned, Jacob Lordy, and also coming out is the rom-com I was talking to you about. And also they're doing a remake of this movie I'm not allowed to say, Lilo and Stitch, and I'm playing Stitch. So other than that, the money that I have is an empire that I built myself. I'm from the Bronx. I am from the Bronx of Australia, and I've come up from nothing, rags to riches story for me. So me and Donfried gives me $5,000 a month. That goes mostly to my shoe budget. I have a enlarged foot in one leg, and that's something that we talked about, but you told me that's not the first operation we should do.
Well, it's off camera. I am really, I'm worried. I have to be honest, that information is scary.
What exactly are you worried about? That the cash flow's not going to be going anymore?
The money. I'm really worried about the money at this point, because this isn't my passion. I don't want to have to be clocking in every day at the ripping the skin back factory. I want to start my own ice cream store. I'm
not interested in getting any more surgeries at the moment. I need to heal my body, and I need to prepare for my role for the rom-com I told you about. I'm not going to be looking like a totally different person when someone hires you on set. They want you to look the same as when they hired you.
Well, that's not true. I need you to bring the temperature down. We want people to come into the office, okay? Do you need Advil or something?
I'm getting
laughing gas?
Thinking that you care more about the ice cream business than your patients.
Propofol? Because I don't understand why you're being bitchy.
What even flavors are you trying to do?
Well, we've got raspberry, we've got vanilla, we've got I came up with a really amazing line of ice creams called the Comfy Collection.
Oh, my neck is absolutely bollocks right now. I feel like you did something wrong to me in the surgery.
No, we just have to go back in, sweetie. We can go in tonight, and we'll correct that. You're looking like Frankenstein, love.
I feel like I've gotten pretty much everything done.
Yeah.
The lips are bigger, the legs are longer, the butt's bigger, the boobies are bigger. My eyes are more wide apart than before.
Yeah, we moved the eyes. I implanted hairs from her back directly right here. And then we removed all of her eyelashes. And don't worry, eyelashes come back. We removed all of her eyelashes. We straightened the nose. It was crooked and it looked like she always smelled like a big shit, right? But so, no offense, of course, because everything can be fixed. And your cheeks were too big. We fixed that.
And then they were too small, so we fixed that.
And we filled them up again.
Did something called skin stretching around my breasts.
Yes, so this is actually a procedure that I invented. We needed to create more space because her titties were just really little. She wasn't blessed.
You were saying that if I had more skin space on my chest, I could make the breast bigger.
Yes.
Even bigger than a normal breast enlargement. And also, by the way, we at first made them too small, and then we got them bigger again.
Yeah, and well, the issue with this this breast specifically was we used up all the skin that was available, and you don't know this. We used up all the skin, and so we had to use what we call a cadaver. So we used multiple different cadaver chests. That's why you're probably going to start to see hair growing in areas where there wasn't before. Basically, a person dies. Sorry. Round of applause. And then we put their skin, we connect their skin into yours. So there's a couple suture marks just right across the nipple, and that's going to connect the old nipple to
I
the
actually
new
was thinking when I was looking at my breast that skin, some of the skin didn't feel like mine anymore. And there's actually something that when you get somebody's eyes, someone replaces your eyes with someone else's eyes, all of a sudden you're seeing what they might be seeing, or all of a sudden you're having personality changes. And I actually did think that my skin felt haunted in a way, like there was another person that was embodying me just because I had someone else's skin. I didn't even know that until now.
Yeah.
And yet I did feel like I had some personality things that were tweaked with me. All of a sudden I felt like I was a really super fast reader, whereas before I was reading at a really slow pace. And I'm like, what's going on? And now I realize like that could have been the cadaver skin that's been placed across my breasts and nipples.
Maybe so. There isn't a ton of research on that I've read, so there's no way to know.
Where did you train to do all of these operations on people's bodies? Because you did say that you were a dentist, and you did say you wanted to open up an ice cream shop. And now I'm trying to think about what exactly kind of training do you have to be doing this? Because no one works at your hospital. There's no receptionist. There's no nurse. And that's something that I actually like about being in that environment. Sorry, I accidentally bumped your titties, but I like that. You go in, it's a one-stop shop. The only person I'm seeing in your office is you. There's no receptionist, there's no nurse, there's no other doctors, there's not even any patients. And I'm going, yes, it feels like I'm at her house right now. And I like that because I like that personal relationship. And so I actually really don't mind it much. But now that you're saying that you're like not trained as somebody who, you know, does plastic surgery, but yet I have so much plastic surgery done by your dentist hands, what exactly kind of training do you have? Because I'm starting to get scared that maybe you didn't do something right.
You're starting to piss me off. Because
I'm just wondering what your formal training is because, you know, first of all, the hospital I'm going to, it doesn't seem like a normal hospital. It seems like kind of like your basement or something. There's no receptionist that works there, no nurse, no doctor, and you're the only one, and you're wearing exactly this, and it's always unbuttoned. So I'm just wondering, did you go to some sort of training to be able to give people plastic surgery? And that's something I'm just asking to be open-ended question. I'm not even saying I wouldn't come back to you.
You are such ungrateful.
No,
You're ungrateful.
I'm not.
Guess how much boobies cost? Just guess.
$8,000.
$50K per.
Yeah, and maybe in Beverly Hills.
So you're getting that surgery for $75,000, okay? Like, there are experts out there who would be shaking in their grave to hear that, because I'm offering you something at a discounted rate. We've done multiple revisions, and I haven't paid, you haven't paid through the nose.
And I'm a walking billboard for your company.
Yes.
Someone sees my body on screen. I'm doing a sitcom, I'm doing a movie, I'm doing a book deal. Someone sees me, what's her plastic surgery? I see a TikTok video, this is what she's had done, this is where she's had done it. I'm a walking billboard. I'm bringing in 50 grand a month for you. Are there women wanting their bodies different because they've seen mine? They come into your office wanting the look. I'm making you so much more than $75,000 a tit. And also, again, that's a per tit. That's pretty close. I don't know what you're saying, that it's industry standard. And by the way, you convinced me of so many different body changes. You're trying to get me to come in for an armpit removal tomorrow, and I just don't think I can go under the knife.
You know what? It's just funny, because when you're a female business owner, and I will say that, because I'm not one to shy away from the facts. When you're a female business owner, people are bitches to you. And people test your limits, and they want you to react. Well, guess what? I'm not reacting, okay? I'm staying calm. I'm doing my surgeries. I have 3 surgeries later tonight. 1 at 9, 1 at 11, and 1 at 12.
I don't think you should be operating people that late at night. I do not think you're yourself at that late at night.
No offense, you're not the dentist here, okay? So I'm gonna need you to keep those comments to yourself.
I just can't imagine anybody watching this right now and thinking that this person should go and take a knife to them, a scalpel to their neck. I just do not think that anybody could be watching this right now and trust you. You have absolutely no credentials, something that is not something that I knew before today. I walk into your office, I look up, there's a picture of you, and the words say, official plastic surgeon. I think this person has their degree. You're telling me now that you don't. So what am I to do?
I don't. Happy? I don't. Wait, look over here. I think we could do...
No.
We could meet. Hey, you're my patient. I think that women have gone down a scary path where some of them, they're not wearing makeup. Some of them, they're not shaving their underarms. So, I'd just like for you to kind of give people, if they're on the fence, why they should choose Dr. Baum.
I thought before coming in, I would choose Dr. Baum because she has a little tiny waterfall in her office that I thought sounded relaxing. And it's like you walk in there, you black out, you wake up with a different body. And I didn't mind that. But coming here today, I realized I never want to see you again. I don't trust you. And so I would say go to anyone besides Dr. Baum. It's not an Oasis, it's the opposite, it's hell.
Thank you, sweetie. Thank you so much.
And what do you say about my body now that you've changed every bit about it?
Well, I think you're a work in progress, like we all are. And I think that we could do 70 to 80 more little things, nip and tuck, and I think we're gonna send you on your way, aren't we?
Sorry, my butt is stuck to the seat.
It's okay, sweetie.
Thanks for having me.
Ugh. Oh gosh. At Oasis, everyone is a work in progress.
I'm a work in progress, love. After going to Dr. Baum, I've had trouble smiling. I've had trouble moving my eyebrows. I've had
That's normal.
restless leg syndrome, but all day.
Completely normal.
I've gotten sick over dairy. Lots of bleeding.
Yeah,
But I've never looked better and never felt better.
that's normal. So those are all normal side effects.
When I'm seeing a street sign, I'm thinking it's a person.
That's normal.
And when I'm seeing people, I'm thinking it's a street sign.
That's completely normal.
My vision has been completely blurred. I've not been able to drive.
That's
Cannot memorize lines anymore when I'm on set. And oftentimes I can't even understand who I'm looking at.
That's
Sometimes
normal.
I think I'm in the scene, I'm talking to the director.
Completely normal.
I no longer dream while I sleep.
Normal.
During the day, sometimes I think I'm dreaming.
Totally normal. Hey, normal.
And I also sleepwalk a lot, like way too much. And I also feel like I've become addicted to playing Parcheesi.
I think that's normal.
But other than that, my sex life has been amazing. It feels better than ever. And
Putting that on Instagram. I am a dentist, plastic surgeon, and future ice cream entrepreneur. Welcome to Dr. Baum's Oasis. Hey, put a smile on that face. Just up. I can hold it. As a female small business owner, CEO, I take pride in making sure that other women are fully taken care of and fully supported throughout their stay here at Oasis. Now look at that smile.
something I also like about her office is she does offer luxury retreats where you're not only able to get a surgery done, you're also able to eat breakfast with her, you're also able to cook lunch for her, and then you're also able to order out dinner with her too. So it's 3 meals with Dr. Baum, 3 surgeries, and also they have one of those big metal buckets in the back that you could fill up with water, and it's like a swimming pool, so it's almost like there's a spa that she runs a spa in her house. That's one of the reasons why I like going to Dr. Baum.
And Chick-fil-A is not off the menu because it's right next door.
You are my favorite doctor no matter what. Go to Dr. Baum or else. Seriously, this woman is amazing. Even though I get upset with her, all of a sudden I forget what was I mad at. Get me back into her office. This person is amazing. This person she also sings during their surgery, so you might be out, but you might hear her singing.
Look at your crow's feet.
She is so awesome. I love this girl. I'm addicted to her retreats. I will not leave her home. I will not leave her office. I will keep getting surgeries from her, and I will sleep over, and I will keep making her lunch, and I will take her up on her giving me breakfast and dinner. And she can go crazy on a box of 40-pound chicken nuggets.
It's really sweet to hear you say that. You're my first and only patient, and it's just nice to feel supported by another woman. Growing up, let's be honest, I had these huge tits. So a lot of women felt extremely intimidated, and they would attempt to derail me at every step of my career. I barely became a dentist.
I was extremely jealous of this person when I met her. And then when I got to know her, I thought, that person is one of my closest friends and one of my closest doctors. I think this person is awesome sauce, and I would never dream of being a mean girl to you, and I don't get along with women at all. I don't even want to be in a movie with them. I mean, I'm clearly a male, what is it, the chaperone phrase, oh, she's your pop star's favorite pop star. I am male actor's favorite female actor. So I only work with men, and you're the only female I get along with, besides my mother.
Really?
Yeah, and I don't even always get along with her.
I feel the same way. Without sounding too brash, I hate women.
They're too dramatic. I'm sitting on set, if I'm acting with another woman, she's constantly thinking of making the whole scene about her, thinking of her emotions.
Oh no, I just got my period.
Yeah, I can't even get to do it. But this girl, when I sleep over her house, I get my surgery done, we have our 3 meals, we're sitting there, we're watching Under the Tuscan Sun, and I look over at this woman, she's crying, and I go, this is the woman that I want to spend my time with. If I'm not with my mother, I'm with her. I love this girl.
You're gonna make me cry.
I don't think that you're qualified to give people surgeries, but you sure hell make it fun. I'm a work in progress.
So, Fawn,
Let's do the dang thing.
we are going to have you lay down, and I'm going to show you what a consultation with me looks like. How about
Yes.
that?
I love that idea because I want to help you people, and I think you could be looking
Just
as
shut up
beautiful as
and
me.
lay down. All right. So, perfect. So this is where I like to have my patients lay down. We do all of our surgeries right on this pleather couch. Facebook Marketplace, $150. Not to brag. So I'm going to point out a couple different areas where we are going to get to. I like to think of all of my patients as a mountain that we're climbing. We're trying to get to the top. We're going to do everything that we can to get you to that beautiful mountain peak where you're a gorgeous woman that every man will love. So we're going to take it from the ankles. I personally like to just chop the foot off and just start over because it's just cleaner, okay? So then we basically we just unzip the skin. Sorry, love, for touching you.
No, that's okay, love.
We're unzipping the skin from the back because on film, we're almost never going to see. Have you ever seen Meryl Streep's calves? I don't think so.
Well, did you say her calves?
No, yeah, we're never looking at her calves. We're going to unzip the skin, and then we take it right up to the ass cheek. So whenever we do our full implantation, we actually slice open the cheek from the front labia, from the front of the hip bone, the whole way back to the crack, the ass crack. So we'll lift that up. I like to scoop the back. How about you? Do you like the look of the scoop?
I thought that when you mentioned the scoop, I thought, hell no, why not?
Yeah.
And then once you did it, I thought, I don't really know if I like this, and then I got used to it.
Perfect. So we like to scoop the back. We just scoop it. And then I like to add, a lot of my women, they have these really, really weak shoulder blades. So I like to stuff in. I'll stuff in like a hard, it's kind of like a Lego. So we'll put that just beneath the dermis. Yeah. And then I like to just replace the neck a lot of the times. We'll use Cadaver for that. It's just a lot simpler and it's a lot tighter. Oh gosh, and then we're gonna get started on the face.
Also, I got a lot of the chin and the ear. I got my ears pinned back, and I think that that's still also healing. But other than that, I feel like I'm doing pretty well good.
Well, that's not really up to you, is it? But yeah, so that's how our consultations usually work. We'll just mention what we don't usually talk about in society, you know?
What happened to your shirt? You spilled some coffee on it.
Oh, I spilled some coffee. I'm fucking my assistant, so he ran in through the door. He's so excited to see me, so.
He's 23 years old. There's no doubt about it, I'm still a work in progress. I'm a work in progress.